Hi, my name is Pam Hensley, and I'm doing my head-to-toe video assessment with Kylie here. She's volunteered to be my patient. It's for my 612 health assessment class. When she was waiting to come in, she had emptied her bladder. They did a full set of height and weight and vitals on her, which were all normal. We also tested her distant vision with the Snellen chart, which was 20/20. When she walked into the room, I washed my hands. I also observed her gait and her, make sure she was dressed appropriately for the season. And now we're going to move on to the physical assessment. I'm going to start first by inspecting her face and her head, looking for any abnormalities, masses, lesions, any skin breaks. I'm also going to test her skin, make sure that it's nice and warm, which it is. I'm going to move on to palpating her scalp. Again, looking for any masses, rashes, lesions, any abnormalities, any pain. I'm feeling for her hair, which is nice and soft. Next, I'm going to palpate over her face, looking for any abnormalities or pain. Anything there? Nope. Next, I'm going to test her temporomandibular joint. I'm going to have you open your mouth, move it side to side. I'd be looking for any crepitus or popping noises, which I don't hear. Now I'm going to palpate her frontal sinuses and maxillary sinuses. So here's her frontal. Any pain? Nope. Maxillary, any pain? Nope. Okay. Now I'm going to move on to testing her cranial nerves. I'm going to have you clench your teeth, squeeze your eyes shut, wrinkle your forehead, smile, stick your tongue out, and puff up your cheeks. Okay, and those are all normal. Now we're moving on to light sensation. So I'm going to take this Q-tip swab. I'm going to touch you either with the soft end or the sharp end. I want you to close your eyes and tell me what you feel, okay? Dull, sharp, dull, sharp, dull, sharp. Okay, now I'm going to move on to our extremities and do the same thing. So I'm going to have you close your eyes. Dull, sharp, dull, dull, sharp, sharp, dull, sharp, dull, dull, sharp, dull. Okay, and those are all normal. Now I'm going to move on to her eyes. We tested her eyes earlier, as I said, but we could also do the Rosenbaum chart for her near vision at this time. I'm going to be looking for the symmetry of her eyes, looking for anything abnormal. I'm going to be looking at the distribution of her eyebrows, also the distribution of her eyelashes and that they're outward. I'm going to be looking for any exudate. I'm going to be looking at her sclera, making sure that it's nice and white. There's no yellowing, no exudate, no redness. From there, I'm going to look at her conjunctiva, which is nice and pink and moist. I don't see any problems there. Then I'm going to check her pupillary response. I'm looking for that her pupils are equal, round, reactive to light, and accommodate. I'm going to do direct and consensual. Oops. Okay, just look at me right here. Direct, consensual, direct, consensual, and those were all normal. Next, I'm going to have Kylie, you stare at my pin light here and cover one eye, and then uncover, cover the other eye, and uncover. And that was fine too. I'd be looking for any kind of jerky movements, which I did not see. Next, I'm going to be checking her extraocular movements with the 6 cardinal fields of gaze. So I'm going to have you stare at my pin light. Don't move your head, okay? And that was normal too. Now I'm going to test her visual field. So I'm going to have you cover the same eye as me. And then tell me when you see my fingers. Now, 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 now. Now cover the other eye. Now, 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 now. Okay, and that was also normal. So now we're going to move on to her nose. I'm going to be inspecting it, looking for any abnormalities, making sure it's symmetrical. And then I'm going to check the patency via first. I'm going to have you hold one nostril shut and breathe in, and the other one. And that was fine. Next, I'm going to be looking at her nasal mucosa. I'm going to be looking at her turbinates and her septum, make sure that it's midline. And that septum is not deviated, it's midline, and they're moist and pink. And now we're going to move on to, I didn't notice any polyps or anything unusual, any exudate in the nose as well. So now we're going to look at her ears. We're going to check for alignment. We're going to check for symmetry. Anything unusual again, lesions, masses, anything out of the ordinary. I'm going to palpate the auricle of them. Do you have any pain? No. No. Okay. Next, I'm going to be looking into her auditory canal. I'm going to be visualizing the tympanic membrane. and it's pearly gray, and I don't see any bulging or any redness. All the landmarks are visual. Next, I'm going to do the whisper test. So I'm going to whisper a few words. Kylie, tell me if you hear them and repeat the word.
Okay. Apple. Baseball.
Okay. And that was normal as well. So now we're going to move on to the Weber and Renee test. So I'm going to strike the tuning fork. Kylie, I'm going to place this on the top of your head. You tell me if you hear it both ears or just one or the other.
Okay.
Oh. Okay. Next, we're going to do the Renee test. I'm going to put it on your mouse bone here, and then I'm going to put it here. So I want you to tell me when you stop hearing it here and when you stop hearing it here. Okay. I'm going to strike the tuning fork again.
Stop. Stop.
Okay. And that's normal. Air conduction is twice as long as bone conduction. Next, we are going to move on to her mouth, and I'm going to inspect first, looking for symmetry, looking at her lips. They're nice and moist and pink. Then I'm going to be going inside of her mouth and checking her mouth. I'm going to be looking at the buccal membranes. I'm also going to be looking at the hard and soft palates. I'm going to be looking at her pillars, her tonsils, and her uvula is midline. I'm going to be looking underneath her tongue. Okay, looking at the floor of the mouth, looking at the lateral sides and her gums. I'm going to be assessing her teeth, checking for any cracks, any missing teeth, malodorous breath, any signs of infection. I'm going to do her gag reflex next. And so I'm going to have you say ah. Okay, and swallow for me. And that was normal, her uvula raised. Next, I'm going to go on to her neck. I'm going to inspect her neck first. I'm going to be looking for any masses, any enlargement of the thyroid or goiter, anything unusual with her skin, and it seems to be normal. Now I'm going to move on to, I'm going to assess for JVD, where she doesn't appear to have any. I could also lay her supine at a 45-degree angle and check it, but I don't see any noted. I'm going to palpate the trachea, and that is midline. I'm also going to palpate the thyroid. Can you swallow for me? I don't feel any enlargement or nodules. Next, I'm going to palpate her carotids, one on each side, one at a time. And those are normal. Next, I'm going to palpate her nose, the preauricular, the postauricular, the occipital, the tonsillary, the submandibular, the submental, the anterior cervical, the posterior cervical, the deep cervical, the subclavicular, supraclavicular, can you raise your arms for me, please? And the axillary. And those are all fine. Next, I'm going to check her passive and active range of motion. I'm going to have you put your chin to your chest, and then to the back, side, and the other side, and just shrug your shoulders. Then I'm going to do it again with resistance to my hand.
Okay.
Forward, back, side, and shoulders. And those are all normal. Next, I'm going to auscultate her carotids and her thyroid to listen for any bruise with the bellow of my stethoscope. And those were fine. I didn't hear anything. Next, we're going to move on to her upper extremities. Again, I'm going to inspect first, looking for hair distribution, color, any abnormalities if one's bigger than the other. I'm going to also look at her muscle mass. I'm going to palpate down, looking for any pain. I'm checking temperature, which is fine. I'm going to check her capillary refill, which is brisk and less than 3. I'm going to check for any cyanosis or clubbing, which I don't see. I'll be checking her brachial pulses bilaterally, and they are equal. I'm also going to check her radial pulses bilaterally, which are equal. I'm also going to check her brachial reflex while I'm here, which is normal. Now I'm going to move on to her back and posterior chest. So Kylie, can you turn around, face the wall for me, please? So I'm going to inspect the symmetry of her back. I'm going to be looking for any curvature. I'm going to be looking if she has scoliosis or kyphosis, any abnormalities or masses. I'm going to palpate down her vertebral column, looking for any pain. I'm going to palpate with my hands also, looking for any pain. Is there any pain?
No.
Okay. I'm going to check for tactile fremitus. So Carly, when I put my hands on you, I'm going to ask you to say 99.
99, 99, 99, 99, 99.
Now laterally.
99, 99, 99, 99.
I'm going to do it anteriorly as well to compare all the sides equally.
99, 99, 99, 99, 99.
Okay. Next, I'm going to check for her thoracic expansion. So I'm going to place my hands here about the 10th rib. Kylie, can you take a deep breath in for me? Okay. One more time. Okay. Next, I'm going to percuss systematically, comparing side to side. And I'm going to do that laterally also. And anteriorly, comparing all sides. Okay, next I'm going to check for her diaphragmatic excursion. So Kylie, I'm going to have you take a deep breath in for me. Hold it. I'm going to percuss down until it changes to dullness. I'm going to mark it there. I'm going to have you breathe out a couple of times. And then breathe in again. I'm going to do it again until I hear dullness. I mark it there. When measuring it, it's at 3 centimeters, which is normal. And next I'm going to auscultate symmetrically, side to side, systematically, with the diaphragm. Take a deep breath in. Again. 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 Good. Good. And then laterally. Then I'll do it anteriorly as well. I didn't hear any adventitious breath sounds and her lungs are nice and clear. Now I'm going to be checking for CVA tenderness, so tell me if you feel any pain. Any pain?
No.
Okay. Now you can turn around to me. I'm going to move on to the anterior chest and heart and lungs. Excuse me. Again, I'm going to start with inspection. I'm going to be inspecting her chest, looking for any abnormalities, looking for her depth of breathing, her rate of breathing. She doesn't appear to be in distress. She seems to be not using any accessory muscles. I'm going to be looking to see if there's any abnormalities, pulsations, thrills, or lifts, which I don't see. I'm going to go over her chest with my hands, feeling for any crepitus or pain. You have any pain? No? Okay. I would also be looking to see if there's any pulsations or heaves at this time. I'm also going to palpate now for any pulsations, heaves, or lifts over her chest, which I don't feel. I'm going to palpate the point of maximal impulse, which is at her 5th midclavicular. Okay. I already palpated for a tactile fremitus earlier and auscultated earlier. So now I'm going to listen to her heart sounds. So I'm going to be listening to the aortic at the right sternal border at the 2nd intercostal space. I'll be doing the pulmonic at the 2nd intercostal space at the left sternal border. I'll be doing the herbs at the 3rd intercostal space, the tricuspid at the 4th and 5th, and the mitral at the 5th. Herbs, cuspid, and mitral. I'm listening for S1, S2. I'm listening to see if there's any S3, S4 or split S2s. I'm also listening for any murmurs or abnormalities. Now I'm going to take the bell of my stethoscope and I'm going to go over the same exact spots, listening for any bruits or murmurs as well. Okay, now Kylie, I'm going to have you lean towards me so I can listen to see if there's any aortic regurgitation along the left sternal border of the apex. Okay, now moving on to the abdomen. So Kylie, will you lay down for me, please? Yep. So with the abdomen, I'm going to be inspecting it first. I'm going to be looking at the contour with some lighting, checking for any masses, any abnormalities. Skin seems to be intact. There's no ascites. Her umbilicus is midline. And so from here, I'm going to move on to auscultating. So I'm going to auscultate all 4 quadrants. I'm going to listen for about 2 to 5 minutes with the diaphragm. Next, I'm going to be using the bell of my stethoscope to listen for any turbulence or bruits, abdominal, renal, iliac, and the femoral. I didn't hear any there. I'm going to palpate her femoral pulses as well, and they're 2+ bilaterally equal. I'm going to palpate for the width of her aorta. I'm also going to be noting for any excessive pulsation. And now I'm going to percuss in all 4 quadrants for tympani. Next, I'm going to percuss for liver span. So I'll be percussing up until I feel dullness, until I hear dullness. Deep breath. I'd mark there, and then I'm going to percuss down the mid-clavicular line until I hear dullness. I'm going to mark there. So the distance between the 2 is 6 centimeters, and that is normal. Normal, I believe, is 6 to 12. I'm going to percuss for splenic dullness. Deep breath, Kylie. And I didn't hear any. Next, I'm going to palpate for light palpation, checking for any masses or anything unusual. Any pain?
No.
Okay. Next, I'm going to move on to deep palpation. Tell me if you feel any pain.
No.
Okay. Next, I'm going to palpate for the liver border. So kind of have you take a deep breath in for me. And it's smooth and I don't feel any nodules. And next, I'm going to palpate for the spleen. And that's fine. Excuse me. Next, I'm going to try to palpate for the right and left kidneys. So Kylie, take a deep breath in. Okay, and I don't feel either of them. Next, I'm going to palpate her abdominal muscle and look for any hernias. Kylie, will you put your head up for me, please? And that's normal, so you can now sit up, Kylie. Now I'm moving on to the feet and the legs. Again, I'm going to start with inspection. I'm going to be looking at her legs for color, hair distribution, any edema, any abnormalities. I'm also going to check temperature. Temperature is fine. I'm going to be looking at the musculature. I'm also going to palpate down and look at the musculature of her feet and legs, and I don't feel any abnormalities. I would check her capillary refill, which is less than 3, which is brisk. Checking for any clubbing or cyanosis, and that's fine. I'm going to check her popliteal pulses, her dorsalis pedis pulses, and our posterior tibiale pulses, and those are all fine. Next, I'm going to move on to check her reflexes. I already did her brachial ones earlier, so I'm going to do her knees and her Achilles. Oops, sorry. Okay, and those are fine. Now I'm going to check her muscle strength. So kind of have to stick your arms out. Straight, yep. Push up, push down, put them up like this. Push, push, put your arms out, spread your fingers. Okay, good. Shrug your shoulders. Okay, I'm going to do the same with your legs. Push, 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 pull. And those are all within normal. So now I'm going to have Kylie stand up in front of me. Can you squat for me? That's normal. Now you can stand up. I'm going to have you lean over in front of me. I'm going to be looking at her back again, palpating down, seeing if there's any pain or anything in her back. Looking again for scoliosis or kyphosis, which is normal. You can stand up, Kylie. And that concludes my head to toe video assessment. Thank you for watching.